Okay, so this is an alternative treatment technique for the respiratory diaphragm. This is a side-lying position that I use in my own practice. We have the patient lying side-lying as close to the edge of the table as possible, as close to the therapist as possible. The therapist is going to lean their hip, their greater trochanter of their femur, into the patient's mid-thoracic cage, then slowly finds the lateral costal margin with both hands, slowly sinks the fingers around the subcostal margin and starts to traction the subcostal margin superiorly, cephalically, and laterally. The patient can take a deep breath in, and as the patient takes a deep breath out, the therapist slowly sinks the fingers more into the subcostal margin and exerts more of a lateral traction, respecting the reciprocal tension of the treatment tissues. This is held until at which time there is no resistance from the patient's tissues. And once this point is attained, then the patient can take their same side arm slowly over top of their head to a nice comfortable position. As long as there's no shoulder pathologies or concerns, the patient can do this. If there are shoulder pathologies and concerns, then we don't include this aspect of the technique. Once the arm is over top of the head, the therapist then has a little bit more elasticity to the tissues and can exert a final lateral and superior traction on the subcostal margin, matching the reciprocal tension of the tissues in this area. The patient breathes normally, and this is held until which point there is no tissue resistance being felt by the therapist. And once that point is attained, then I'm going to get you bring your arm back down. And the therapist releases their contact with the patient's costal margin, and the treatment technique comes to an end. So this is an alternative technique for respiratory diaphragm. What I like to do is have my patient lying on their side near the edge of the table, have a pillow for support at their head. I like to contact the full lateral side of the rib cage, making sure that I have my fifth finger in contact with the lower costal margin. Each of my other fingers interdigitate into the intercostal space. I have full contact into the lateral costal margin, and what we do is we instruct our patient to take a deep breath in and exhale all the way out. And as they exhale all the way out, the therapist lowers their pressure towards the table, drawing the respiratory diaphragm medially towards the center. We are matching the reciprocal tension of the tissues. This technique is performed in 2 sets of 10 repetitions and held until at which point you can no longer feel any resistance in through the tissues. At that point, if your patient doesn't have any shoulder pathologies or concerns, you can take your right arm over top of your head, and the therapist can increase pressure again medially towards the table. This causes an elevation of the rib cage, placing more traction on the respiratory diaphragm, but also allows the therapist to compress more medially, causing a lengthening and relaxation of the respiratory diaphragm. We meet the tissue resistance until at which point it can no longer be felt. At the end, the treatment is at the end. And I can get you to bring your arm back down. And take a deep breath in. And as the patient inhales fully, the therapist releases their compression onto the lateral rib cage, and the treatment is done.